Next question is, a patient presents with gustatory sweating after the parotidectomy. What is the diagnosis? So whenever we will do parotidectomy, when and they have gustatory sweating, it is called as Frey syndrome, and this is because of damage to the auriculotemporal nerve. So injury to auriculotemporal nerve will lead to the gustatory sweating. Horner syndrome is because of sympathetic chain, okay na? And the symptoms will be meiosis, ptosis, and anhidrosis, okay na? So symptoms will be these. Bell's palsy, if you know, it is because of facial nerve damage, and glossopharyngeal neuralgia means pain in the area where glossopharyngeal nerve is supplying. So this is also not the answer. So correct answer is Frey syndrome. Next is, there is a 25-year-old male present to emergency department within 24 hours of history of abdominal pain, started around umbilicus, now localized in right lower quadrant. He reported nausea, low grade fever. Physical examination will show tenderness at McBurney point and rebound tenderness in the right lower quadrant. When you have checked laboratory test, it shows mild leukocytosis. What is the most appropriate next best step? So this is the classical presentation of appendicitis. Okay na? So if you know appendicitis, that it is the inflammation of appendix. Pain generally started around the umbilicus, and after some time it will settle down into the right lower quadrant. Along with this, patient can feel nausea, vomiting, low grade fever, and whenever you will check the tenderness in the right lower quadrant, you will feel tenderness at the McBurney's point, and it will also show rebound tenderness. When you will check the blood count, you will see mild leukocytosis, means they will have shift to left in leukocyte count. What is the best step? So since it is the classical presentation, we have made the diagnosis. So there is no use of ultrasound, no use of CT scan, because if the symptoms are very classical, we will proceed with appendectomy. Okay, so correct answer is appendectomy. Why we are not giving intravenous fluid or observe? Because first, we can use intravenous antibiotics, but we will be using in patients where surgery is not indicated, because surgical indication or appendectomy is the definitive treatment of appendicitis. Okay na? Why not observe or only observe? Because it can lead to the serious complications, like it will lead to the appendicular abscesses, it can lead to the perforation of that appendix. That's why this is the incorrect. Second, perform abdominal ultrasound. If we have already classical presentation of the case, we need not to do ultrasound, and these ultrasounds are mainly used in the pregnancy and into the child to check the appendix. CT scan is very highly sensitive. It is highly sensitive and specific. Okay, but still, if we have a classical presentation, all symptoms, all criteria are met, no need to do CT, no need to expose patient to the radiation. Better we can do appendectomy, because the ultimate treatment for appendicitis is appendectomy. You can do by open appendectomy, or you can use laparoscopic appendectomy. It depends on to the patient. Next question is, patient complains of fluctuating mass in the floor of mouth, which is brilliantly transluminant and bluish appearance. What is the diagnosis? This is the classical feature of ranula. Okay na? So ranula appear in the floor of mouth. Here you can see, whenever it is fluctuant, whenever you will pass the light, it will be brilliantly transilluminated and it is blue in color. So ranula. So what is ranula? Ranula are mucus cyst, okay na? Mucus extravasation cyst, which are commonly occur in floor of mouth. They arise from the obstruction of any sublingual gland duct, okay, and they will also lead to the mucus extravasation into the nearby tissue. These will be fluctuant, bluish, translucent, brilliantly transilluminated cyst. So this is ranula. Okay na, so correct answer is ranula. Why not dermoid cyst? So here you can see this child, here is a small elevation or cyst. This is dermoid cyst. So dermoid cysts are generally non-translucent. Okay na, so these are non-translucent. They contain keratin, okay na, or sebaceous material. So if they are containing these material, if you will transilluminate them, they will become opaque. Okay na, so they will be opaque. So that's why this is not the correct answer. Next is sublingual abscess. Sublingual abscess generally tender, and these are erythematous and non-translucent abscess. Translucent abscess. Since it is abscess, it will contain pus. So if pus is present, you cannot transilluminate this, and along with this, patient will also complain of pain, warmth, and some systemic signs of infection. Since here nothing is mentioned, so this is not the answer. Next is cyalolithiasis. Cyalolithiasis means salivary gland duct stone. Okay na, so salivary gland stone, duct stone are called as cyalolithiasis. So these will be hard non-fluctuant mass in the duct of salivary gland. Patient will feel pain during the eating or swallowing, and they will also have swelling, and these are more commonly associated with the submandibular gland. So that's why this is also not the answer. So correct answer will be ranula, which is the classically present as fluctuating mass in the floor of the mouth, and it is a mucosal cyst, and it will lead to the extravagation of mucus in the nearby tissue. Whenever you will transilluminate, it will be brilliantly transilluminate. So correct answer is ranula. Next is, there is a patient came to the OPD with chief complaint of swelling in the neck region, moves with deglutition and protrusion to the tongue. There is a rupture of swelling with pus discharge. What is the preferred treatment? So if you know any swelling which is moving with deglutition, which is moving with deglutition or protrusion, or with which is moving with deglutition and protrusion of tongue, this is the classical presentation of thyroglossal cyst. Okay na, so if you know thyroglossal cyst, they are attached to the base of the tongue. So whenever you are protruding the tongue or you are degluting, at that time they will move. Okay, but now they said they have rupture of the swelling and pus discharge. So what will be the management? So this is a infected thyroglossal cyst. So first or primary management will be, we need to do incision and drainage. When the infection subsides, then we will do a operation. We will resect the cyst, and the operation or surgery for the removal of thyroglossal cyst is called as cyst trunk operation. We will remove the cyst. So primary treatment or preferred treatment for right now will be incision and drainage, remove the pus. Okay, so first option is saying it is present with ectopic thyroid tissue. This is also true, but here they are asking the treatment, so this is not the correct answer. Second one, acid fast staining is done to make diagnosis. No, because it is not related to tuberculosis. If it is tuberculosis, cyst or infection, they will not protrude with the tongue, or they will not move with the deglutition. It can progress to squamous cell carcinoma. Very rarely it can progress to squamous cell carcinoma. So for the treatment purpose, right now the correct answer will be incision and drainage. So here all the surgery questions are finished. Thank you very much, and if you have any doubt, please do comment. We will reach out to you, and if you like this discussion, please like, share and subscribe. Thank you.